Welcome everyone to our Ask Me Anything webinar on the Affordable Connectivity Program Enrollment Performance Tool. I'm Revathi Prasad, Director of Research and Fellowships at the Benton Institute for Broadband and Society. For those who don't know us as well, we are a nonprofit focused on broadband policy. We work to support a broadband for all agenda by ensuring people have the timely information, rigorous evidence, and practical guidance that they need. As part of our research work, we supported the development of the Affordable Connectivity Program Performance Enrollment Tool that we'll be discussing here today. As you all know, ACP is a broadband assistance program for low-income families authorized by Congress in the Infrastructure Investment and Jobs Act. Eligible households get $30 a month to help defray the cost of service, or $75 if you're on tribal lands, and up to $100 for an internet-capable device to get online. So far, roughly 19 million households have enrolled in the program, some 35 to 37% of eligible households, but we can get into the data later. The FCC has established grants to improve outreach and awareness of the program, and those are the folks we hope are in the virtual room today. There are a number of organizations tracking enrollment and use of this subsidy. Others have developed a range of resources to boost enrollment in the program, but that's the conversation that we hope we're contributing to today. Our tool, or to be more accurate, the one created by John Horrigan and his colleagues Hernan Galperin from USC and Brian Whitaker of Oklahoma State, focuses on how individual zip codes are doing in terms of their enrollment. With that, I'm going to introduce our panelists that'll come on screen. Dr. Horrigan is a national expert on technology adoption, digital inclusion, and evaluating the outcomes and impacts of programs designed to promote communication technology adoption and use. He served at the FCC as a member of the leadership team for the development of the National Broadband Plan. Additionally, as an associate director for research at the Pew Research Center, he focused on libraries and their impacts on communities, as well as technology adoption patterns and open government data. He's been studying broadband affordability, examining programs like Lifeline, Emergency Broadband Benefit, and now the Affordable Connectivity Program. Welcome, John. Also joining us today is Elena Salzman, the Director of Campaigns at Civic Nation, where she oversees short-term campaigns and grant-making projects for the organization, including Online for All, a national campaign launched in partnership with the U.S. Department of Education to help close the digital divide. She joined Civic Nation in 2021 to help lead Made to Save, a national public education and grassroots mobilization campaign to build trust in the COVID-19 vaccines and help close the racial gaps in vaccine rollout. Elena lives in Washington, D.C., and previously spent several years working on electoral campaigns and at political advocacy organizations. Elena is also the lead author of the pilot report for Civic Nation's ACP outreach and enrollment programs, examining the work of 5 community partners that we'll be discussing today. Thank you both for being here. A little word on logistics before I hand off to John and Elena. For the event today, we asked you all to submit some questions beforehand, which we'll pose to John and Elena soon, and we'll have open time for additional questions in the second half of the hour. Me and our producer, Grace, will be checking those questions as they come in so we can get them to John and Elena. Please submit questions through YouTube comments or through the Google form we had included in the invite. We also have the tiny URL for the Google form up on screen, and we'll keep putting it up periodically. Sadly, you cannot click on it on the way that we have this set up right now. But hopefully it's not too long to type out. I mean, YouTube will be much easier to submit questions, but we wanted to give you another option. Before we get to the question, I'll just ask John to first introduce the tool and offer some broad analysis on ACP enrollment tools, ACP enrollment trend. John?
Sure. First of all, glad to be here today and to join Elena in this undertaking. Thank you all for signing on and taking some time. I'm just going to go through a handful of slides, really just to explain how the tool works. And then I think we'll have a chance later on to do a little show and tell on actually using the tool and how it can be relevant to decision makers in the field. So if we just go to the next slide, Grace. really the fundamental question the ACP tool answers is, how's it going with enrollment? I'll talk shortly in a little bit about different ways to think about what ACP enrollment data means. What we're doing with the tool is developing a statistical model to predict the level of ACP enrollment, predict what it should be in a 5-digit zip code, and then compare the predicted enrollment to the actual enrollment figures in a particular zip code. The difference between the two is a measure of performance. The statistical tool that we use relies in part on ACP enrollment data, but it really relies on a lot of data about particular communities, based on the premise that although eligibility is obviously an important factor to think about when considering ACP enrollment, community and social factors structure people's decisions. So we wanted to bring those factors into the analysis, and American Community Survey data on socioeconomic characteristics, demographic characteristics, the percentage of households in a given area who are already connected to the internet, the percentage of households relying only on a cell phone data plan for service. All those factors are important to predicting at a given time the level of enrollment of ACP in a particular area. And again, we're going to compare the predicted level to the actual level. Next slide, please. As we look at our data, you can look at aggregate ACP enrollment data. As Revati said, 19 million households roughly have enrolled in the tool, not in the tool, in the ACP program to date. And that is close to 40% of eligible households having enrolled in the tool. A couple ways to evaluate ACP data. One is growth in enrollment, how that has changed over time. But as I've noted and explained, we're going to take a good look at the performance aspect. Again, the difference between what our model predicts enrollment should be and what actual enrollment levels are. One cool thing that we bring into the model, I think is cool, is to try to capture the role of anchor institutions. And we do this particularly by having data on whether a particular zip code area has a main public library branch in it. And if we go to the next slide, there's some information on what the influence of libraries are. They boost enrollment. The presence of libraries are associated with a 6% increase in performance. So anchor institutions have something to do with performance in ACP enrollment, and so does outreach. This is a little bit of a teaser. We're going to look at Sioux Falls, South Dakota, and Dallas, Texas a little bit later on. Elena will tell you why. And it'll help us use the tool as a way to understand whether outreach efforts have had an impact. Next slide, please. We think this is useful to decision makers because the tool does help identify drivers of performance differences like anchor institutions, and it invites explorations of levers that can change performance. And it's also a tool for prioritizing community engagement. In a sense, ACP performance can be thought of as a proxy for digital inclusion capacity in a particular area. You can go to almost any city and develop a tale of two zip codes story, which is to say, you can look at two zip codes, often close to one another geographically, often with very similar demographic characteristics. But when you look at the ACP performance tool numbers, they may have very different performance metrics. One zip code may be signing up more households for ACP than predicted. Another household may be signing up fewer households than predicted. And the question is why? And the tool can help stakeholders focus that question on particular areas and see whether, for example, the area that's overperforming has existing digital inclusion capacity in the community that may matter. And perhaps if there's a deficiency in the place that's underperforming, stakeholders can try to devote resources there to make up for those performance gap differences. So with that, I will stop with this overview of the tool and turn it back to Revati for Elena.
That's great. I actually asked you the question of why I think Elena would be great to come in in this conversation right now and tell us a little bit about the pilot project that Civic Nation just ran.
Yeah, I'd love to. Thanks so much for having me. Really excited about this tool and the ways it can help folks do their outreach. I think I have some slides somewhere. There they are. Ooh, so big. Great. So as John mentioned, or as Revati mentioned, Civic Nation a few months ago did a pilot program from December to February where we provided grants to 5 community partners to start new on-the-ground ACP outreach and enrollment programs. And we're going to look at 2 of the communities that we worked with later and see, sort of what the impact of those programs were using the performance tool that John and Co have put together. So just a quick I'm just going to give a quick overview of the work that we did here, but really encourage everyone to go read the pilot report. Ton of information about these programs, how they were similar, how they were different, learnings from there. But it was very successful over a 12-week period. These 5 community organizations educated almost 40,000 community members about the ACP. They had over 2,700 one-on-one conversations about the program, helped over 400 people start applications, and helped over 200 people get fully enrolled in the ACP, which we consider to be having their benefit applied with an internet provider, which saved folks over $75,000 on internet bills, which is a pretty cool thing for folks to be able to do. So I'll just go over a couple top lines from the report that I think will be useful to this conversation, but really encourage everyone to go check it out. Next slide. So we did this work in 5 communities. We'll look at 2 of those later in this call, but we worked in Detroit, the greater Philadelphia area, Dallas, Texas, Memphis, Tennessee, and Sioux Falls, South Dakota, working with community organizations that work with really specific populations in those areas who are typically underserved, and had a lot of folks who are eligible for ACP. So it was a great community to be able to do this work with. Next slide. Again, just a kind of a quick overview of some of the really interesting data that we found during this pilot program. One thing we were really curious about is, sort of how much outreach does it take to get how many people enrolled? And we found that about 15% of the people that our grantees had conversations with about the ACP ended up starting an ACP application. And about half of the folks who started an application with one of our grantees were able to get fully enrolled and have their benefit applied with an internet provider by the end of the pilot. I will say that this pilot took place before there were some changes made in April of this year to streamline the application. But we did find still that applying the benefit with the internet provider was a big barrier for folks. And so the barriers around the 50% were less around the application itself and more around sort of getting folks to actually apply their benefits as well. Next slide. I won't get too much into this, but a huge finding from our work was really just the importance of, when you're doing ACP outreach, of having a really strong, what we called an enrollment pipeline, or just a really strong process for moving folks through from having an initial conversation with someone to ask them if they'd be interested in signing up for the ACP, to checking their eligibility method, how are they going to be applying, helping them with their application, and like I said, getting them to apply that benefit to their internet plan or start a new internet plan using their benefit. For a lot of folks, this can be pretty quick and easy if they're eligible through a federal program that has a data matching agreement where they can confirm their eligibility just using their social security number. For other folks who were eligible through federal programs or income that don't have data matching agreements, it could be a lot harder, and it took a lot more work from navigators to help folks get across the finish line. But across all 5 communities we worked with, really the key to folks' success was having just like a really strong process for moving folks through each step of the application and enrollment process. Next slide. Another big finding from our work was just what kind of outreach is most effective and is least effective. So we did find across the board that what we called warm outreach was much more effective than more cold or impersonal outreach. So, talking to folks in person at community events, working with partners to have office hours or walk-ins at anchor institutions or with other community partners, particularly working with schools and parents was really effective. And doing personal phone calls to community members that you already have a relationship with. These were all really, really effective tactics. A little less effective, social media, sending out mailers, kind of cold knocking on doors, anything that sort of didn't already have a warm relationship was just a little less effective. Next slide. Oh, great. And I just threw these in here, a couple more fun data points that I thought folks who were interested in this call would be interested in. But about 15% of the folks who signed up for ACP during this pilot did not have an active internet plan and enrolled in a new plan to use their benefit. And about 90% of the folks that were signed up during this program applied their benefit to a home internet plan. About 10% used it for a mobile plan. We also found that our grantees reported spending an average of 56 minutes across 3 separate interactions on each completed enrollment that they supported. Again, this happened before some steps were taken to streamline the application, but what we did find was for a lot of folks, again, the application could take 15 minutes. Getting on the phone with an ISP could take another 10 to 20 minutes, so they could do this in 30 minutes. But particularly when there were language barriers or any problems or any kind of barriers with getting folks the right paperwork to do their application, it could take up to 60, 90 minutes. It took a lot longer to help folks that just needed a little more help. Next slide. So just our key takeaways. Again, I encourage folks to read the full report, but I think some key takeaways, particularly for this conversation today, are just that trusted community messengers, as John said, like anchor institutions or community organizations, are really the key to driving higher ACP enrollment. And so when we're looking at the ACP performance tool, thinking about, where is enrollment lagging, where is performance lagging, and how can we work with trusted community messengers in those areas to increase uptake, particularly in communities where there are language barriers. Folks should really prioritize having a really intentional pipeline of how they're moving folks through the process. And also that the most effective outreach is really just meeting folks where they're at, physically going to communities with lower rates of enrollment, physically going to, schools, faith communities, gathering places in a community and talking to folks about this and helping them with their applications. Across the board, across all the communities that we worked with in this pilot program, that's what we found worked best. I'm not sure if we want to do these now or do these later.
We're going to come to that in a little bit. Thank you so much for the introduction, Elena. Moving on to the asking questions portion of the AMA. Let's start with the basics on the tool. I'm going to bring John back into the conversation. We got a version of this from Melissa Hart of Transcend International from Salt Lake City, Utah. What are the most effective programs for deploying this resource? Maybe, John, you can share your screen for this piece and show us how the tool works.
Sure. Let me do the present button and share the screen. As I do this, one thing to know about our tool is that we are, with today's session, announcing an update to the tool, our initial version, and I hope now it looks like everybody can see the screen. Our initial version of the tool had data current through January of 2023. Now we're updated to April 2023, which is very good news. So that's one announcement about what we're about here today. The other one is, as I walk through data on Dallas, Texas, this is data on one of over 25,000 zip codes that go into the tool. We are allowing the data underlying the tool to be downloaded for free for users who want to use it. So we're doing open data on the tool. And let me talk about what that data is exactly. So Elena noted that they did pilots in Dallas, Texas, and Sioux Falls, South Dakota, among other places. So Elena shared me some zip codes that were targeted in Dallas, and I'm just picking on one zip code, the 75216 zip code in Dallas, Texas. And to use the tool, you go to our search box in the upper right corner of the tool's landing page. You enter your zip code and hit search, and you get a result. And the result is all this information going down the right portion of the page. The first thing you see is that in Dallas, Texas, the performance is high. What that means is the tool predicts that about 7,100 households should be enrolled in ACP, but actual enrollment is around 8,200 households in this particular zip code. So that means more households have enrolled than the tool predicted, so performance is high. This is a place where Elena's organization funded outreach, and since we know that this outreach occurred in around December and early into this calendar year, we're looking at data a few months out. We can see performance is high. This is an indicator that this outreach did not go for naught. As you go down the right-hand side of this, you can see a bunch of other data about this zip code. Only 39% have wireline broadband. Lots, 15% rely on cell phones only for their internet service plan. This information comes from the American Community Survey 5-year data that does give us this kind of information at the zip code level. You can read down the list for additional characteristics. I want to call your attention to information at the very bottom, and I'm going to see if I can increase the size of things here. I'm going to do that one more time. And if you see down in this part of the screen, we're sharing some new data in this version of the tool. We're sharing claimed subscribers, which is information that USAC provides. So there's always a gap between enrollment and claimed subscribers because when a household enrolls in ACP, it's not instantly that they have service at home. When they have service actually going at home, that's when they are claimed subscribers. And we have this data for this zip code in Dallas. 7,100 households have claimed their subscription out of enrollment of 8,200. That's a high ratio of claimed to enrolled, which means that the process that Elena laid out of having conversations with people, determining whether they have interest, signing them up, and then getting them to have service in their household, which does take some time. It's going pretty well in this particular zip code, since close to 90% of households have claimed service who have signed up. The other data point that we share, which is just directly from USAC data, is the total support in dollars. So in this zip code, $240,745 have been claimed is the amount of support in this particular period. So you can learn something about just how much flow of funds are coming into this particular area in Dallas, Texas. So just doing this shows that outreach seems to have made a difference in Dallas. And if you're a stakeholder, not only can you understand performance, which is very high, you can get a bunch of other data points that might be of interest to you as you plan for digital inclusion outreach. So I could do Sioux Falls if we'd like, but I thought I might just pause and see if there's any comment from Elena or questions or anything.
Thanks, John. I'm actually going to pose a big question to Elena first. And you already touched upon this a little bit when you were talking about warm versus cold outreach and enrollment pipeline. But the question comes from Mark Logan of IDEA Elect in Kansas City. What kinds of communication tactics and activities are proving most effective for boosting enrollment?
Yeah, definitely. We can share these slides after I've seen some requests for that, and definitely check out the pilot report, and we have some fun graphs and all of that. But like I said, warm outreach is much more effective. And what I mean by that is, tactics are leveraging existing trusting relationships that folks have in their communities. So whether that is folks that your organization has relationships with, or working with partner organizations. In Dallas, Texas, for instance, the group that we worked with there is a group called Somos Tejas. They're incredible. They're a bilingual organization. They work in English, they work in Spanish, they work with immigrant communities, they work with, really a wide variety of constituencies in their community. And one thing that they did, I have this on a slide somewhere, but we don't really need it. In the course of a 12-week period, they went to over 29 different community events, festivals, health fairs, career fairs. They did some pop-up clinics with an after-school program. They did a pop-up clinic with a program for young moms that's doing job training. They kind of just worked with a variety of different folks in their communities. They put up a table in the lobby of a community theater that was doing performances right around the week of Christmas. They just went everywhere where people were already going, and they had their signs, they had their flyers, and they said, hey, have you heard about this program that can get you free internet or save you $30 on internet? And by doing that, as an organization that folks trust them, they do other work in their community that have led folks to feel good about their relationship with this organization, and you just keep seeing them everywhere talking about this. One incredible story was Ramiro, their executive director, I think it was his mom or a close friend of his, asked if she could host some other women on her block in her house and talk about ACP, because she signed up and it was so incredible. She had like 10 or 15 other women from her neighborhood come to her house and had Ramiro come talk about this program. And as someone who had just signed up, she could tell people, this is real, this is not a scam, you should sign up. So really just like leveraging relationships that already exist in these communities, whether that's your community or whether you're looking at the map and looking at the zip codes that are underperforming and reaching out to faith communities, schools, libraries, community organizations in those zip codes that serve those communities. You can really just leverage the trust and the relationships that folks have there already. Things like, social media ads or, sort of like more impersonal things where, you're putting information out to folks who may not know you, who may not trust you. We just found to be much less effective than working through partnerships and working through relationships folks already have.
Thanks so much, Elena. John, I think it would be really fair to say that most questions we got on the tool were about the data and the logic of the tool. And you spoke a little bit about this earlier, but maybe we can delve into it a little bit. So Catherine Fosberg of Sonoma County Economic Development Board asked us, how is the data sourced? I think we just received a comment from YouTube, a question from YouTube about showing households under 15,000 instead of under 29,000. So maybe you could talk a little bit about the data that's coming in and also a little bit about the logic of the predictive algorithm that you have developed.
Sure. On how we put the tool together or the model underlying it, we made a number of high-level decisions at the outset that took us down a path to look for specific data points. We started from the presumption that eligibility levels will matter a whole lot to whether people sign up for the tool, which is completely understandable. You should not enroll in ACP unless you meet the eligibility criteria. So we wanted first to understand in particular zip code areas what share of households were eligible for the ACP program. So that required a little bit of work. The eligibility criteria for ACP kind of starts with all households who are at or below 200% of the federal poverty level. But then additional criteria are government benefit programs such as using SNAP, Pell Grant, supplemental security income, using Medicaid for healthcare insurance. So we went through a process to estimate in each zip code how many people are eligible or how many households are eligible through those other criteria, which are additive to the 200% federal poverty level criteria. So that helped us understand the share of households who are eligible for ACP. If you just relied on 200% of federal poverty level, you'd get something like, I think 35% of households nationally would be eligible for ACP. When you add those other criteria of other federal benefit programs, that gets you up to around 40 or 42% of households being eligible for ACP. So we did that, but that's focusing very much on the individual household. We wanted to bring in other community characteristics to the analysis. So we looked at indicators to help us understand places, not just with lots of eligible households, but with lots of households with very low incomes, such as those whose annual incomes are less than $15,000 per year. That's getting you into a severe poverty range. We brought in race and ethnic characteristics of communities, Black-headed households, Hispanics, Asian-headed households. We included education metrics. We included age, since older Americans tend to not subscribe to tech services at the rate that others do, and they tend not to subscribe to ACP at the level that others do. So we put those and some other community metrics, such as the percentage of households who are rent burdened, which is to say paying a lot of their their disposable income on rent. The percentage of households not in the labor force, households with or communities with high shares of households with teens either not in school or not in the workforce. So we brought all those into a model that is the algorithm that predicts the level of ACP enrollment. We also included a measure of whether a zip code is in an urban or a rural area. So those are some of the ingredients that went into the soup that predicts the level of ACP enrollment, and that's the key output of the model that we then use to compare actual ACP enrollment.
Oh, Ravide, I think you might be muted.
Yeah.
Whoops, had to happen at least once during the hour.
Mm-hmm.
I think we have a question for you, Elena, coming in from one of our Google Forms. It's the longish question, so I'm just going to read it out. It's excerpted on screen as well. The ratio of home internet to mobile subscription among the organizations you worked with is much higher than for all ACP enrollments. Did the organizations make concerted efforts to promote home internet, or are there other factors to which you'd attribute this difference?
That's a great question. I think there's probably a couple things that I attribute to this. I think first and foremost, we did encourage folks to have conversations with the people they helped sign up about, how does your family use the internet? What do you use it for? Make sure that they had the speeds that they needed. And so I think given those conversations, a lot of folks that they worked with did have a preference for home internet after having that conversation and talking about what they needed it for. I think the other piece of it is a lot of folks did apply this to an existing plan they already had. So, by 85% of the folks that signed up through this pilot program already had internet, and a lot of them already had home internet. So they were applying it to their current plan. I think in terms of why it's so much higher than ACP overall, I think many of us on this call are aware there's a lot of mobile providers who are also going out and doing in-person outreach and, are offering, tablets or phones, or they're offering devices to help folks sign up for mobile internet plans. And, a lot of folks are signing up through those outreach as well. A lot of times mobile internet plans can be cheaper than home internet plans. So, if you are signing up for ACP and you want free internet, those options are available, far and wide on the mobile side as well. So I think a real variety of reasons for that. But, I do think at the end of the day, if you sit down with somebody and talk about their internet needs, and if they decide they prefer to have home internet, ACP can really make that incredibly affordable for folks in ways that they didn't expect home internet to be affordable for them.
Thank you. You've both teased some of the show and tell data that you have from Sioux Falls. So I think one of the questions I wanted to pose to both of you was, coming from your experience, Elena, working at both national level and then working with communities at a much more smaller geographies, how can organizations use this tool to do better outreach? I think you guys have some presentation work from Sioux Falls.
Yes, I do have a slide, I think, about Sioux Falls, if we want to throw that back up. Yeah, there we go. So, I mentioned this a little earlier, but in terms of how folks can use the tool, like I said, I think looking in your community, in your city, in your state, whatever level that you work at, and seeing where there are places that are underperforming and reaching out, as John mentioned, to anchor institutions are so critical to this. Schools and libraries, community centers, anywhere folks already sort of have a community gathering place that you can work with and have those trusted relationships. So, looking around the tool, seeing where that is in your area, and reaching out to organizations and institutions to build partnerships and help folks get signed up. One of the grantees that we worked with, South Dakota Voices for Peace, they're based in Sioux Falls, South Dakota. And I think they had a really great example of doing this. They worked with Hawthorne Elementary School, which is the only CEP school, Community Eligibility Provision School, in the Sioux Falls School District, at least as of this past school year. For those who may not know, community eligibility provision is a way for an entire school to be eligible for free and reduced price lunch. And if your kid goes to a CEP school, then your family is eligible for ACP. So every single family at Hawthorne Elementary is eligible for ACP by nature of having children enrolled at that school. So what South Dakota Voices for Peace did was they reached out to the principal and they worked together to set up a table to do ACP sign up at parent-teacher conferences. They sent out flyers in advance to make sure that parents knew they would be there, knew what kind of paperwork they might have to bring. And a number of parents came prepared with their paperwork to sign up because they got those flyers in advance. And a number of parents who couldn't make parent-teacher conferences called South Dakota Voices for Peace and said, I couldn't make it, but can you help me? I want to get the discount for internet. And, this is a really great example of how to work with an anchor institution in your community. And because the tool pinpoints it by zip code, you can see like where are the schools, kind of not school districts, but the school areas, I don't know the exact term for this, coverage areas that really need the most help. And how can we use our capacity, whether you're a city, a state, local community organization, whatever level at which you work. Obviously we all have limited capacity to do, really hands-on community outreach. But I think a great way to use this tool would be to figure out which areas in your area that you work are ripe for this kind of deep engagement. To John's point of like, where is there capacity for digital inclusion? Maybe it's not worth, well, I would say not worth, but maybe your time is better spent in some of those purple areas than in some of the green areas if you're going to, reach out to schools or libraries or community organizations to build partnerships and do this kind of hands-on outreach navigation work. And also, if we go one more slide, I want to just elaborate very briefly on the Dallas work. Because we got some great stuff here, but I just want to really emphasize also the bilingual flyers I put on both of these slides. Just making sure as you're doing outreach, thinking really critically. We don't want to look around the map, find a zip code, and be like, let's go there, and not come prepared. Making sure that we're prepared for whatever the demographics of that community are, whatever the makeup of that community is. We found that doing work in multiple languages was really a key group of folks who are being left out of ACP enrollment are folks for whom English is not their first language, particularly dealing with paperwork and working through the application that's only available in English and Spanish. There was a huge amount of work, particularly in Sioux Falls, South Dakota, with recent refugee communities, particularly with our group that we worked with in Philadelphia, with Asian American communities. The language barriers and being able to do work in language was such a huge part of the success that some of these groups were able to have. So I wanted to make a note of that as well.
I was going to make a quick data point on Sioux Falls. which is in the 57104 zip code. If you look at the tool, that zip code is a high performer, which is to say more people have enrolled than the tool predicted. And also, since I have way too much data on ACP, I know that that performance metric for Sioux Falls, which is high and which means it's very good, has improved since late last year, which is the time horizon over which Civic Nation's grantees were doing their work. So the tool can add some data to the stories that Elena has so nicely laid out about how their work has unfolded in Sioux Falls.
So great to hear. I will pass this along to them. I was on the edge of my seat for your analysis, John.
John, did you also have some analysis from Dallas that you would want to share at this point?
I think I went through Dallas before, I'll just add quickly, since I have the floor. We do include the percent of foreign born in our analysis to get to the very point that Elena was just raising, which is that's a crucial predictive variable in the rate of ACP enrollment. When English is not your primary language, that's a huge barrier to getting access to government benefits. ACP is no exception, and we include that in the tool to help better understand its impact on enrollment.
I have a couple of questions coming in from YouTube that are, I think, quicker answers about the tool and about how ACP works, and maybe I'll just put them on the screen now. So from Ann Campbell, I think that one's for you, John. How is the amount of total support dollars determined?
That comes directly from USAC, so that includes the amount of spending for on the $30 per month benefit service subsidy, and on the equipment benefit. You can get $100 computer credit if you need it through the ACP program. I should say the very strong majority of the spending is on the $30 per month service subsidy. So that figure that's in the tool output is the sum of the equipment plus service subsidy, but it's mostly service subsidy because that's just how ACP is unfolded.
I think we also have a question that came in via email. The person's interested in how many types of devices have been distributed. What types is there data available on that?
Not on types of devices, just the expenditure on devices.
Okay. And for Elena, I think you mentioned something about CEP, children in CEP schools. There's a clarification.
Yes, very exciting. Every household, if your child attends a school that participates in the community eligibility provision, you can qualify for ACP based on your dependent. I will say, I know I mentioned earlier that there are some eligibility methods that are a lot quicker to get your application approved than others. CEP is a little bit tougher. You have to get a letter from the school, saying that your kid goes there and that they participate in CEP. So I will say that if you are eligible through something else, through Medicaid or SNAP or something that you can data match via social security number, that is a better way to apply. It'll just be quicker and easier. But if the only way that you're eligible for ACP is through your kid going to a CEP school, highly encourage you to still pursue that. You just have to get a letter from the school, and it can be a little bit trickier to do that.
Great. We have two questions from Jim Mercante. I'm so sorry if I'm mispronouncing your name. The first is on the full cost of the program if people are already subscribed. I think this might be to John, and I'm going to throw up his second question too because it's a broader question, which is about the resources needed to execute the signups. And I think, Elena, you could probably speak to that pretty well.
So on the first question, if you could run that past again, it was a little unclear to me on the full cost of the program. If people were already subscribed. So the benefit, say $30 per month, goes to households who didn't have service before And as Elena said, in their experience, that's about 15% of enrollees didn't have service before. There are figures from other contexts that put that number a little higher, maybe 20 or 25%. But then there's the 75% of households who are eligible for the benefit and get $30 per month. The total support number that we have in the tool, which comes from USAC, doesn't differentiate between the new subscribers versus people who already had service and were eligible and signed up for it. So I'm not sure that's answering the question. So I'll stop there.
Yeah, I'll say I'm a little confused by the question as well, but I will say that in the pilot, we did find a real wide variety of, whether folks were, they might have had an internet plan that cost $90. And once they signed up for ACP, they also were looking at their internet options and seeing what else they could sign up for. And it turns out there was one of those $30 plans they could sign up for with their $30 off. Now it's free. So we had one person that went from a $90 bill to $0. We talked to somebody who went from a $50 bill to a $20 bill. So, in terms of on the personal level, I can't speak to the aggregate level the way that John can, but on a sort of like individual level, the changes in people's bills and the amount that they were saving really widely varied based on if they were changing their internet plan, if they were moving to a cheaper plan. Sometimes people moved to a more expensive plan because with the discount, they could afford something with higher speeds. I think, really, this is one of those instances where, every family, every household is going to be different in their internet needs, and, makes ACP gives them more flexibility to make the best choice for them, which is really great. In terms of the resources needed to execute the signups and are these full-time service orgs community volunteers, specifically the grantees that we worked with are all organizations with full-time staff. They range from like having 2 or 3 full-time staff, like very small community organizations, to, larger organizations with 20, 30 staff. But we asked them just to commit to having at least one staff person spend at least 20 hours a week of their time doing ACP outreach. I think most of them ended up spending closer to like 30 hours a week on this work because it's very engrossing work when the community is really excited about this stuff. So a real wide variety in terms of like how much time and effort was spent on this. The grants were $25,000. So that is how much folks spent on this work. Some of them have since gotten funding from other sources, which is really great. And some of them are continuing to do this work. They've made it and sort of embedded it into their offerings. Some groups also sign people up for Medicaid or do other benefits enrollment, which is really great. But if you have more questions about sort of the resources to do ACP enrollment, definitely recommend you check out the pilot report. We have some budget breakdowns in there, and happy to chat more about that offline as well.
Thanks, Elena. John, to you, I was wondering if you could talk a little bit about the data in the tool going from zip codes and how you would transform that into cities. And I know that you have some new work coming out about cities. Maybe you can preview that a little bit.
Sure. People do wonder what is going on in their city, not just their neighborhood. And in the coming weeks, we will add to the tool data on performance metrics by city. So one can go through a process, and that person is me, of aggregating zip codes into cities. And doing that can characterize what performance is for a given city. And I can tell you there's considerable variation in performance in the aggregate across cities. So that'll be, stay tuned for that in the coming weeks. As I said, it's possible to aggregate zip codes into cities. They don't map perfectly. Zip code boundaries are not drawn with city boundaries in line, but there are tools so that you can get pretty close so that you can deliver some findings by city so that cities can understand in the aggregate how they are doing it in comparison to others. And like I said, there's some interesting variations once you dig into it.
To Elena's point earlier, I just wanted to bring in one of the YouTube comments we just got about an agency in upstate New York with 30 employees running a number of programs and one person doing ACP outreach at 30 hours a week. I have a couple more questions before we'll have to move towards closing remarks. So before, I'll ask quickly a data question, which is does the tool include reporting free phone Lifeline recipients that have their ACP applied to their phones? Because I assume that might be a quick answer, John.
That is a quick answer. The data does not address that.
Okay. Another question that we got, sort of a big picture question, which can actually lead us nicely to our concluding remarks, would be what insights regarding trends in ACP performance have you found through the tool? And that one comes to us from Kat Aquino from Education Superhighway.
Not a surprise coming from Kat. One thing that is coming across is that community matters. It's not just about the individual decision to sign up. The context around people matters a great deal. So there are what economists would call learning externalities associated with ACP signups, because we see factors above and beyond eligibility predicting levels of ACP enrollment. One interesting thing is we do find that eligibility has a significant correlation with ACP signups. Even controlling for levels of eligibility, so does severe poverty also have a positive and significant correlation with ACP signups. So what's interesting is usually if you live in an area of deep or severe poverty, the metrics for you as a household usually aren't very good across a number of different categories, health, education, et cetera. However, for ACP, it's kind of breaking through that pattern, since we find that areas that have very low incomes do tend to have higher rates of ACP uptake. So I think that underscores the value of the benefit to people. An inspiration for the ACP was, oh boy, the pandemic has finally gotten people to get it through their head that the internet really matters as an equity issue. So we're going to go all out to get people online through first the EBB, the emergency broadband benefit, and now the ACP. And the data shows that that inspiration is mapping to the behavior of the lowest income Americans who are using the benefit to get connected. So when governments do new programs, stuff doesn't always work out. The data thus far shows that the ACP is being used by the people who need it in the areas that need it most.
That's great. Elena, I think the same question goes to you as well.
Well, I can't speak to trends in data the way that John can, but I think what John said is right on. Like the data and the the quantitative data and the qualitative data show that the ACP is working. It's helping the audiences. It's helping the folks that need it. And I think we had some questions around home internet versus mobile internet, or people who are signing up for the first time versus applying into existing plans. And at the end of the day, that the folks who are eligible for this program are the folks that could really use another $30 a month in their pockets, whether that's to spend on groceries, spend on rent, spend on increasing your internet speed so you can afford a plan with more speeds if you have a bunch of kids in the household all trying to do homework at the same time. We heard so many stories during our pilot program from community members who, this is life-changing. There's seniors on fixed income who, an extra $30 a month and not having to worry about paying their internet bills goes such a long way. There's kids who can do their homework from home now. There's, so many different examples. I'm sure a lot of folks on this call have similar stories, but the ACP is really having an impact for 19 million households, which, I know we're all working toward full enrollment, and 40% is not 100%, but the fact that 19 million folks are have an easier time affording their internet bills because of this program, I think is really an incredible feat. And so I think sometimes we have to pat ourselves on the back for that. That's, it's going well. Could be going better, but it's going pretty well. So, I think in terms of trends for performance, it looks like, I don't want to speak out of turn. John can speak to this better, but I think it's like a million new signups every 2 months or so has been the going rate for quite a few months now, which I think is pretty promising. It hasn't leveled off the way that some people thought it was going to level off at a certain point. It's continued to grow. Obviously, the more it grows, the faster it runs out. So there's a lot of work that needs to be done as well on making sure that we can, make sure this funding doesn't run out. This funding gets extended or added to, or whatever we can make work. But I think it's clear that it's working for the folks that need it. And it's on us to make sure folks continue to be able to take advantage of this program, and that folks don't start getting kicked off next year, and that we're able to keep it going.
That's a really great point, and it dovetails nicely into our closing thoughts. I want to be sure that both of you have time to reflect on any big picture ACP things, especially right now, considering the funding future is uncertain about the program. I know that in terms of the specific impact of ACP, John, you've done some really interesting work on subscription vulnerability. I was wondering if you wanted to touch upon that. And Elena, tell us about what happens next after the pilot program as well. John?
So I'll go first quickly on subscription vulnerability, which is a category of lower income internet users who are subject to disconnection if they have an economic disruption in their lives. That's as many as 40% of lower income households fall into this category. So we're not talking some people are on the internet and some people are off. We're talking about people who go on and off, again, depending on economic shocks. The ACP really speaks to that category of internet user who, if an economic downturn hits them, may have to make a choice between groceries and internet service. So the ACP is really speaking usefully to a significant chunk of lower income households who fall on some spectrum of the digital divide. And I think as people think about ACP going forward, it's not only about getting new people connected, although if you asked me 2 years ago, could you do something to get 20% of the disconnected online? People would jump at that, and this is what ACP has done. But it's also helped the other 75% of eligible households who are using the benefit to stay connected and to have a little more disposable income for their household needs.
Oh, sorry. Yeah. In terms of what's next, so we put out this pilot report a month and a bit ago, and in conjunction with Civic Nation, the organization I work at, we just launched in partnership with the U.S. Department of Education a new campaign called Online for All, which is really focused at increasing participation in ACP, as well as advocating for broader uptake in digital equity programs. We currently have over 400 supporting organizations signed onto the campaign, and we actually have our first monthly campaign call tomorrow with all our supporting organizations. That is, I will say, supporting organizations instead of partners, because of the government partnership it's like a weird term I have to use, but basically 400 organizations have signed on to partner on this campaign. And we'll be holding monthly calls. We'll be having discussions much like this. Tomorrow we'll be talking about back to school season and ways that you can best work with schools in your area and leverage the types of events and community spaces that are going on during back to school season. So that'll be the topic of discussion at tomorrow's call. And I encourage anyone who's interested in checking that out to go to onlineforall.org and check that out as well. We'll be doing a ton of stuff over the next several months.
Fantastic. Thank you so much. That's really exciting, as are the tool updates that you mentioned earlier, John. With that, I want to close out our webinar for today and thank you both for your participation, for your time today. Thank you to our audience for their excellent questions and for their work that they're doing on getting this essential program that brings broadband within reach for more families. We will be sending out a recap of today's event in the coming days. Slides will go out to everyone that was signed up through Eventbrite, and the recording will be available on Benton's YouTube page in perpetuity, I guess. If you have any feedback for how we ran today's webinar or suggestions for future events, please let us know. With that, thank you all for joining us today.
Thanks so much, Revati. Thank you, John, for this tool. It's so exciting.
Thank you all.
Yes, we're getting lots of props about that.